Hey everybody, welcome to the Ins and Outs with Lynn and Liam. I don't know where Liam is on the screen. This is actually our 20th episode, which we're super excited about. And we happen to have a special guest today. It was not planned as part of the 20th episode, but let's pretend like it was. So with us is Dr. Potter, or Dr. Amy, as we might call her. And she is the medical director for Planned Parenthood of Central and Western New York, which basically means she is in charge of all things medical at our agency. And so we thought it'd be fun to ask her a bunch of fun questions and really share some information about like how things work at the agency, and then also get to know our really rad doctor. So we're just gonna ask a bunch of questions. She might ask us some questions, and then you're all gonna smash the subscribe button and follow us every week.
Hit that like button.
Yeah.
And also, just to let everybody know, me and Dr. Amy did not decide to wear the same thing on purpose. It just happened that we both ended up wearing our Planned Parenthood t-shirts.
Why don't I have that t-shirt is the question. I've never received this t-shirt.
No?
It's an old one.
No, I only got a white one once.
I got this one from Sarah Vernon one time.
Man, I get ripped off over here in Niagara Falls.
Good, Niagara Falls always black.
Okay, Liam, you ready?
Yeah, and I have the first question. So, Dr. Amy, before you came to Planned Parenthood, what did you do? What did you practice?
Yeah, absolutely. Well, first of all, thank you guys so much for letting me come and hang out with you today. I've been a fan and have been watching the videos and enjoying them, so I'm thrilled to get to take part. So a little background about me. I actually went to medical school at the University of Rochester, which is kind of how I got connected to this area, to Western New York. I'm not from here originally, but did my medical school here and kind of fell in love with being able to know my farmers and have lots of good access to healthy, fresh vegetables right outside my door. But despite all of that goodness, I moved back to the West Coast for my training, which is where I grew up. And did my training in family medicine in Seattle. And so family medicine doctors, for those people who don't know, are primary care doctors. You get trained to take care of kids, you get trained to take care of adults, and you actually get trained to deliver babies. So I did my 3 years of training in family medicine, and because the world is ironic and brutal, I ended up meeting my husband while living in Seattle, who is from Canandaigua, New York, right outside of Rochester. So in the brutal ironies of the world, we moved back to Rochester, which I was actually really excited about because it allowed us to reconnect with a community that I really liked and really a medical community that I had found to be supportive. So we moved back here about 6 years ago, and for 4 years preceding my position here, I worked in the community as a primary care doctor. I saw adults, I saw kids, I delivered babies. And then one day a week, I worked for Planned Parenthood as what we call a contract or a per diem doc, meaning I would come and provide services one day a week or one day every couple of weeks, mostly abortion services, and really got to know Planned Parenthood of Central and Western New York through that avenue. So after working for a couple of years doing that primary care work, the position opened up over here for me to make the move over here full time. So I did that about 2.5 years ago, and I actually came over not as medical director initially, but I got hired on as a director of special programs to roll out gender-affirming hormone care for our affiliate. So that was July of 2018. So came over and did a couple of good months of work on that project, and then our medical director stepped down. And so shortly after coming over for a different position, I was asked to take over as medical director and stepped into that position. I'll be coming up on 2 years at the end of November here. So took over as medical director, which is a really different position and role than what I was doing before, which was mostly clinical work, seeing patients, being out in the office, working with medical students and residents. And now my life and my role is much more of a blend of getting to still see patients, but then also having a lot of other roles around assuring quality of care across 10 clinics, And then also some of our other objectives and strategic goals that we have at Planned Parenthood sort of advocacy for patients in spaces that aren't necessarily just the exam room, which you guys know all about because that's how we all tie together. So, yeah.
I remember, sorry.
Oh, I was going to say, I'm really good at talking and tangenting, so feel free to cut me off at any point. So.
I remember when you first got unveiled to the agency. We were, it was at like an all-staff meeting in Rochester, and you go up there and you're talking about gender-affirming hormone care, and I'm just like, who is this person? She's so cool. And I remember like texting people, I'm like, have you met this new staff member? She seems great. And then it turns out you became our medical director.
Well, thank you. Yeah. It happened a little bit quicker than I was anticipating, but it's been a really good road. And I feel very, very grateful to be in the position that I'm in now, for sure. So, yeah, I was really nervous that day, by the way. I was like,
well, you were really great.
300 people I've never met before.
About something that could be like a little, for people who are used to just doing birth control, adding gender-affirming hormone care is probably like a real stressful addition because it's a whole nother thing. So yeah, you were really unveiling a big thing in front of strangers.
The first time I met Dr. Amy was actually at, I feel like the Philly Trans Conference with Chris Culp. And Chris was like talking how happy he was and how much like you knew about trans-affirming care. And Chris was like really into trans rights when he used to work with us. So I was like, oh man, this lady must be like hella smart if Chris is like praising her.
Yeah, no, Chris is tough. So if he likes you and he thinks you're great, it means that you're onto something good here.
Yeah.
So what's the difference between, so like how does your job change since going from general practice to working specifically on genitals for the most part?
Yeah, I'm gonna say a couple of things about that. The first is, for me, it has helped. I guess first thing I would say is it has helped me generally, and this is a very personal thing for me. This isn't something that every doctor feels, but for me, there are components of being a doctor that stink, that aren't that much fun, that lead to burnout. Arguing with insurance companies, speaking of trans-affirming care, arguing with insurance companies about why somebody should get a medication that they need that's truly life-saving for them, after a while can get tedious or frustrating. And for me, being able to bring like social justice into my work and having it be at the forefront of my work decreases my burnout. Like I used to get really mad about arguing with insurance companies, especially when it was about like a diabetes medication or something where you're just like, come on, do this. It feels less stressful or annoying to me to have to do that when it's also something that I feel so deeply like in my heart and soul is important. It's still annoying to have to argue with them, but at least I feel like I'm also like advocating at the same time, or there's like another purpose to it other than just BS administrative work, right? Like there's an advocacy component to it. So for me, that actually helped me in my career with my burnout is to like realign the work that I do with like the stuff that really matters to my heart and bring that more into the forefront on a day-to-day basis. And then I'll be honest, like I share this with medical students all the time. People thank me for my work here all the time, and not just volunteers or the community, but like patients look me in the eye, whether it be an abortion procedure or putting in their IUD, or frankly, gender-affirming hormone care is another area where patients like look at me with such genuine gratitude and say, thank you so much for being here today. Thank you so much for taking care of me. And it's a little selfish, but that's really rewarding, right? Like that makes me be like, yes, this is why I show up. This is why like I studied my butt off for a bunch of years, or I have stressful days, and this is like the antidote to that. And I joke, but it's a little bit easier, and it is selfish. It's a little bit easier than doing primary care. People weren't like, thank you so much for telling me I have diabetes and high blood pressure. Like there's just not that same. Like a lot of my job there was kind of trying to get that buy-in and that purchase from patients that this was important to their care. And, when you help someone be pregnant when they don't want to be or can't be, or you help them to get the hormones that make them feel authentic in their own body, like that gratitude is just so profound. And like even talking about it, I can like give myself goosebumps, And so I will say that's been like a real benefit for me, which is kind of selfish, right? Like patients really appreciate what I provide for them, but it has a different feel at the end of the day.
I think Liam and I have the same situation, like, teaching sex ed, I think there are a lot of sex ed teachers, but I think that there's a different vibe when the kids really like us, right? And we teach in a way that's like inclusive and welcoming, so that they're like, they'll stop by and they'll just be like, oh, hey, or they'll like send us a Facebook message when they find themselves with like chlamydia or something, because they know that we're here. And it's like, okay, yeah, like I'm on PTO this week, but if a kid needs to reach out to me via Facebook Messenger, that's cool. I'm fine with it because it's rewarding,
Exactly. Yeah, absolutely. Absolutely. So I hope that answered your question. And then, there's the part that I can talk about more a little bit later, and this really kicks back to you guys. Like, I think one of the coolest parts about my job now versus doing like kind of typical outpatient primary care is that there's advocacy embedded into my job. Like that has to be part of my job because the work that we provide is political, or it is politicized. Nice pants, Liam.
Nice pants, Liam.
That was my dog locker. I wasn't expecting it to stand up, so I was like, let's go wear pajamas.
I just want you to know, Liam and I match on tops, but I am wearing jeans on bottoms. So yeah.
It also must just be nice to like specialize in something, right? Like we always tell people, we always teach when we teach the kids, like, when you go to your general doctor, they're going to see somebody about a wart and then a flu shot and then your birth control and then diabetes afterwards. And so they're not as specialized. Where if you come to us, like we're probably talking about the same thing all day.
Right, exactly. And I will say, yeah, it's kind of nice to get to like focus my brain on that stuff. At the same time, I so value that I trained in family medicine because and it's not to say one specialty is better than the other, but it is true that I feel more comfortable than a lot of my OBGYN colleagues talking about things like gender-affirming hormone care or talking about incorporating within our clinics things like tobacco cessation medications and helping people to stop smoking or helping to screen for things like opioid use disorder or alcohol use disorder. I love that I have that foundation of training that I can like flex into those spaces as needed and help offer some guidance to our team out in the clinics.
Very nice.
Yeah.
And I was going to ask like what brought you to Planned Parenthood, but I feel like we've kind of talked about that a bit already. But you did say that you came to do the special project of working for trans affirming care. How is that going? And are there any other like special projects you came to work on or that you are currently working on?
Yeah, great question. So I came over to roll out gender affirming hormone care, which some foundation had been laid before I got here about the strategy behind that. And the idea was we wanted to start with that care in the communities where we knew that care was not happening. Now, I want to qualify and say that trans and non-binary care is vastly underserved. So it's not like, oh, Buffalo was great and Rochester was great, but sort of our communities, we identified that Syracuse and Canandaigua in particular, Syracuse being a bigger city, Canandaigua being more of a rural community, were really substantially lacking access to care for patients. Many patients in Syracuse were actually traveling to the Planned Parenthood affiliate down in Ithaca, so to one of our kind of sister clinics that we don't oversee, but there are some folks down there seeing patients. So people are driving like literally 2.5, 3 hours from Syracuse to Ithaca to get their care. So we felt like, again, everybody's in need. but of the need, that was the greatest. So we strategically decided to start there. That's now been going on for about 2.5 years and going really incredibly well. We're always booked up. There are always more patients than there are appointments. So continuing to try to expand access in that community. And then, welcome to 2020, where everything is now exploded and different. But we moved the vast majority of our trans and non-binary care to the telehealth platform because, truth be told, there's not much that you need to do in person to administer this care. It's really more about the conversation behind it. So we've shifted to telehealth care, which interestingly then means it doesn't matter where the patient is, right? It doesn't matter if they're in Syracuse or they're in Canandaigua. So all of a sudden, we're seeing patients in Buffalo, in Lockport, in Batavia, in Rochester. So my goal so it's going well, but my goal for 2021 is to have all of our providers and all of our staff trained and to embed more telehealth or we call it gender affirming hormone care in our clinics, to embed more schedules for gender affirming hormone care kind of across the board. Because I think, it's interesting, like patients in Long Island are just looking to get the quickest access to care that they can. And if it happens to be us by video, there's nothing that prevents us from providing that care. So I guess expanding kind of our regional footprint of who we can impact with that care, and then expanding within our providers, expanding our training to all of our team across all of our sites.
That's awesome.
Did I freeze or did Liam freeze? Oh, it was me. So my husband, one of my husband's best pals is trans. And so, whenever he comes over, he's like, he commiserates about like the issues with access to care. And so I always think, I don't know, Liam, if you feel the same, but it's like a sense of pride that like we work for an agency that is trying to relieve like a massive burden on people. Because like nobody gives me grief when it's just like it's like a discriminatory practice, right?
Absolutely. Yeah.
Yeah.
And it reinforces so much of those feelings of non-authenticity in our society too, right? So not only can you not get the care that you need, but you're also being reinforced that there's something wrong with you simultaneously,
right?
Plus,
like when you see, so my husband's his pal, he is a completely different person, just like life changed, like I've known him for probably 8 years and like completely just a different vibe every time I see him because now he is living the life that he gets to choose. And so it's just like, it's night and day. I'm just shocked every time I see it. And so it's nice to know that we're like adding to like helping people live their best life.
I want to go on one tangent here too. I think the coolest part of telehealth to me so far, and I always say like there's some silver linings to COVID, right? Like there is going to be some good stuff that comes out of this. And one of the things is it like kicked medicine's butt to get more technological. It kicked us into telehealth gear, which is great. And one of the like coolest parts about telehealth, which is true for all of our patients, but particularly for our trans and non-binary patients, is like I already feel like the whole dynamic in the visit is different because they're in a safe space for them. Like, because there's all of this data around, how harmed trans and non-binary folks, how harmful our medical spaces are to trans and non-binary folks, whether it be, microaggressions or actual trauma or harm that they've experienced in offices and emergency departments. And I feel like there's this like weight off of their shoulders, being able to interact with me in a space where they're like, but I'm in my house, I'm safe here, right? Like I am not in a scary office that makes me feel on edge, where I've had negative experiences before, and that trauma is like present the minute I walk through the door, which I think is true for a lot of our patients too, but particularly for our trans and non-binary folks, it's so cool. I think it's really going to shift care. I'm hopeful too that it means more that that the medical community can reconnect then with more people that it has done harm to previously.
So this was not a question that I listed, but your answer inspired it. So Liam and I go to the same doctor. We go see Dr. Julie, who we both love, like truly the best doctor in the entire world. I would like invite her to my wedding if I were to get remarried, like all in on Dr. Julie. And the reason is because she's nice to us. Like she's kind and she's funny. And like, so she just like instills a relationship. How, as the medical director, do you make sure that all of our clinics are giving off that vibe? Because I think our clinics do give off that vibe also.
Yeah, absolutely. I think, when you guys sent me some like ideas of questions before, and one of the questions you had thrown out there is like, what has been one of your biggest challenges so far in this role? And that actually kind of gets into one of my biggest challenges, which is like kind of a consistency of the services you can receive and how those services are provided like across all of our sites. Because I find that like, there's historical stuff, right? Like maybe there was a nurse in one of the clinics for 20 years who did something some way. So that's like the only way they know how to do it in that clinic. But then in all the other clinics, it's done a different way. And that's just because of that one person. So that's been something that I've been really like trying to focus on, and one example of this is like, I don't believe in inserting IUDs without knowing that the patient has ibuprofen on board. Having had multiple IUDs put into my body, I just think that's mean. Like ibuprofen is a wonder drug that helps with pain and crampy inflammation. So like, why would you ever put an IUD in without that on board? And, across some of our clinics, it's standard practice to ask the patient when they walk in the door, have you taken your ibuprofen? And I realized in the past 6 months that at some of our clinics, that just wasn't happening. So there were a lot of people having IUDs inserted without putting ibuprofen in, or without, giving the patient ibuprofen ahead of time, which again, as a woman who's had 2 of those put in her own body, ow, I was like, that's mean. We can do something to help with that crampy sensation, so we might as well do it. So I think, that has been one of my focuses, is to create like some common goals. And then the other thing we do, which we spent a lot of time talking about yesterday within our medical leadership team, is we get data back and we try to follow data. There are these surveys that are sent out to our patients after they've had their visit. It's called Press Ganey. You've probably gotten them from other doctors along the way. It's like a long survey that they send you. And it's both numerical, like, on a scale of 1 to 5, how good was your experience? But then there's also opportunities to write in stuff. And we review those on a weekly basis, and we monitor that. So we get lots of really helpful feedback about the patient experience from that data. So looking at, maybe our worst score is wait time in the clinic. So then we go, okay, like what are we doing to work on flow? What are we doing to work on efficiency? And there's also data that comes back about individuals, right? If you were the provider to see that patient's name gets tied to you, and then we get data back about that provider. So for instance, actually, last week's data, I had seen gender-affirming hormone care patients by telehealth that week. And so there was it was actually so sweet, a write-in from one of our patients saying thank you so much for offering telehealth services for trans patients. And, being able to connect with a provider in my own home was an amazing experience. So we're able to kind of see that data and pull it out. And we also occasionally get data back that's this provider was really rude to me. And then we go back and we go back to that provider and say, hey, what was going on that day? Oftentimes it's 6 things got backed up because our computers were suddenly offline. And so then we go, okay, what do we do about our systems to make sure our provider doesn't have to get that stressed and then have it spill out onto the patient? So we try to make it a pretty, I'm a doctor, so I'm nerdy. And we try to make it a pretty evidence-based process, right? Not just based on notions, but on some real data.
I love data, and I mean, I love data. I think Lynn loves data, and we love evidence-based stuff. So yeah. We're definitely down for that.
Not evidence-based, but I will say, anecdotally, I went to a Planned Parenthood a few weeks ago to get a new method of birth control. And Liam knows this, but you don't know this, Dr. Potter. I've convinced myself that I have HIV all the time. Like, I had this notion in my head that I have had HIV and I forgot to get tested. And so that I've had it for like years and years. And I was going to have to explain to my husband. So I go to the clinic and I'm like, listen, I just need to get this test. Like, I know. And the staff there, like, did not call me. I was clearly being out of my mind. Like, I was like just based in another universe, but they were like kind and patient, and they like, you know, like helped me through my like slight breakdown. Because I like, how do you explain to your husband that like you've had HIV for 10 years and you didn't cheat on it? Yeah, it just like, it spiraled into like a spiral for me. And so like to go there and to not be treated like I was spiraling was like, it was really positive.
You're like, thank you.
And then I got my rapid test in 2 seconds. I don't have HIV.
And then you could go confidently home to your husband and say, it's all good. I don't.
Well, he didn't even know I was worried about it. I was like, oh, I guess what? I don't have HIV. And he's like, why would you have HIV?
Of course.
And I mean, obviously HIV is like a totally livable and treatable condition. But like after 10 years, I was convinced that I was like, it was just like it was a spiral. But they were so nice.
There's so many like irrational emotions that come up around sexual health, though. I mean, it happens all the time. I have this conversation all the time with people who are like, I know I'm being irrational. But, you know, when it's something that provokes a lot of anxiety, sometimes our ability to like pull in that reason brain is just not there. So, you know, it's so interesting. I hear that all the time from our patients, which is I expected to be judged more. Like, that's essentially what you're saying, right? Like, I expected to feel judged or shameful or whatever. And I do think that's something that our staff does an incredible job with, is like meeting patients where they're at non-judgmentally. And that just has to be something in our, like, in the character that we seek when we hire people, because it's not something we specifically train.
Yeah. We really train that. Like, it has to be something just kind of like intrinsic that makes you feel like people feel comfortable when they talk to you.
Right, exactly.
And we also always tell our kids, like, the people we educate, whether they're kids or adults, we're like, it's okay to feel scared when you go to a clinic. Like, that is totally normal feelings that you can have. The important thing is about going there and just like kind of being relieved when you get results.
Yeah, exactly. Yeah, to say to people you shouldn't feel nervous or scared, yeah, that's just not going to happen, right? So yeah, those are really valid and normal emotions. And that's, you know, when I'm talking to patients before I am doing their abortion, I always say, you know, do you have any questions for me, any concerns, anything you want to talk about? And I would say 9 times out of 10, patients say to me, no, I'm just nervous or scared. And I'm like, yeah, that's totally valid, you know, and the only thing I can do is reassure you that our number one priority is your safety. Like, that is truly, and that's where it comes back to evidence and data. Like, we are always just wanting to use the most evidence-based and data-driven care to make sure we're providing top quality and safe care for our patients. So that's like always paramount.
Definitely.
Which leads to the boring part of my job. The boring part of my job is I do an awful lot of auditing of the care that we provide. And auditing is not the most stimulating thing of my life, but it's really important to ensure that quality. So we do a lot of chart auditing and a lot of auditing of our clinicians and nurses and staff to make sure that we're following all of the protocols that Planned Parenthood sets forth. And we have pretty strict protocols in terms of making sure what we offer to patients has evidence behind it and data behind it to ensure patient safety.
Definitely. I don't know about Lynn, but for me, like, yeah, doing like the paperwork part of my education job is just like the bane of my existence.
Yeah. Oh, it's the worst.
Exactly.
I did think it was interesting. You mentioned like protocols and how we have all these policies. You talked to us a few weeks ago about how Planned Parenthood makes the guidelines. Liam, I don't know if you knew that. I didn't know, like, I think you said something, you were like, you know, when you go to your regular doctor, nobody's making sure that they're advancing and staying on top of it. And so it was like mind blowing to me to think like, Yeah, when I go to my regular doctor, although Julie's the best, I'm sure she does it. Nobody's making her like learn the latest techniques, but Planned Parenthood, every 3 years, we are deeply analyzing what we do. How cool is that?
Yeah. Like, I feel like it's, from my perspective, it's such a benefit to me, right? Like, first of all, I get feedback about the quality of care that I provide here, and that's true for me too. Like I get audited just like everybody else. Now, granted, I tap somebody to help me with that, so it's more impartial. I pull our former medical director in to do my auditing of me, but I love it as a provider because I don't know about you guys, but like if I have an assignment and there's no deadline, like I'm very unlikely to do it, but if I know somebody is waiting for it or they're going to be like pissed if I don't do it, I will get it done. Like I will get it done. But I almost kind of need that check and balance. Like I need to know somebody's going to be checking on me. And so in some ways, like I find this really helpful to sort of know that somebody's paying attention to the quality of care that I provide. And it's true. I practiced family medicine for about 4.5, 5 years before I came over here. And I often felt like, am I doing the best things for these patients? Is anybody giving me feedback on my treatment plans? Complex patients with multiple comorbidities, like somebody who's got diabetes and hypertension and high cholesterol, there's not a good cookie cutter one pathway for that situation. And so I often felt like, well, I'm doing the best. I'm, reading journals. I'm trying to keep my eye on the studies that have been published. But, like, it felt like it was all on me to monitor all that, right? And to, like, make sure I was doing the best thing. And what I love about Planned Parenthood is that auditing, that feedback is set up within our system. And then, as you mentioned, Lynn, we have this this, like, Bible of our care here, which is called the Medical Standards and Guidelines. And as Lynn mentioned, that's something that's published every 2 to 3 years, depending on kind of the cycle and the clip, and what evidence has been published. And it's vetted by what's called the National Medical Committee, which is a consortium of, I think, about like 40 to 60 doctors who pick a topic, whether that be like an update to care that we already provide or new care that we should be providing. Like, for instance, PrEP. It's not like hot off the presses now, but PrEP is relatively new, right? We weren't doing PrEP 25 years ago. So when PrEP came around, this National Medical Committee said, okay, these 10 smart doctors, they pull in infectious disease experts, reproductive health experts, sexual health experts. They said, okay, let's look at all the studies. And then they literally, before COVID, sit in a room around tables in the middle of the room, and they debate these studies. They say, well, that one only enrolled 1,000, and did you see this was part of the exclusion criteria in that study? And they set up their outcomes in this way, which I don't think is as powerful as that way, and they debate it. And then anybody else in the room can say, well, what about this? Well, what about that? And then they debate what we should do. So it's this really rich, like, evidence-based discussion with not only data, but also, like, clinical expertise from these relative experts. And then they create the protocols that then, I go out and follow, our clinicians follow, and then I audit to those protocols. I make sure that we're following those protocols, which just makes me feel so much more confident in the care. Like, I'm like, yes, I know I'm doing the right thing, because it's not just me analyzing it. It's like this big group of people who sit around and say, what is the best next step? So, I actually have gotten to now be one of the experts who sits in on like the gender-affirming hormone care discussions, and that has allowed us to then incrementally make changes too, right? Because like when we first started doing trans care, we weren't as smart then as we are now about what the best protocols are. So every couple of years we can update. This has happened for women's pap smears. I hear all the time from patients, my doctor paps me every year still. I still get a pap smear every year, which that's actually like super old school now, because those protocols were really updated technically in 2014 and then again in 2016. But really, we've backed off on the frequency of pap smears and saying, in certain age groups, it's every 3 years, and then once you hit age 30, it's every 5 years, as long as everything's been normal. And there's lots of community docs who are still out there doing a pap smear every single year. And, technically they're not following the best, most up-to-date evidence for how to prevent cervical cancer. So, yeah.
Yeah, I think that's so cool.
I also feel like the same way that you do about, knowing that someone's there, making sure all these things are right, because, when we go out and we educate about it, it's nice to know that, we're not just, talking, there's evidence behind everything we're saying.
Right. And it's not I think, too, sometimes I'm this isn't, my opinion, right? This is not how I feel. This is, there's a large body of evidence that says this is true. Not that facts and truth are really anything that we specialize anymore in our country, but, ideally, you feel that's some real data. It's not just do I like this drug? Do I think this drug works better than another? It's based on facts.
Which helps her. I think about this a lot. So I went to a different OB once. I was searching for something, and then I returned to Planned Parenthood, and I had the implant, and they were like, "Oh, your implant's been expired for a year or over a year because this person who specializes, she's an OB, right? She specializes in vaginas and uteruses. She didn't know that the implant was extended to 4 years." And so I looked at her, I'm like, I can't have you do a tubal ligation. I just lost all faith in the fact that she was up to date,
Right.
And so
right.
it's credibility to me to think oh, all these people are debating the best practices. Okay, I'm all in. I trust you with my vagina and everything else.
Right. Exactly. I know. I didn't know before I moved over to Planned Parenthood full time how this really happened. And the first time I got to go, what was an in-person meeting previously and see this happen in action, I was like, this is cool. This is really cool. It's fun too. I've gotten to tap some friends into the world now too. One of my best friends from medical school became an anesthesiologist, so a sedating doctor. And then she did a fellowship in OB anesthesia. And so I actually nominated her to the National Medical Committee to be on the anesthesia committee because they also debate, what type of sedation should we use for our procedures. So it's kind of cool. It's allowed her, she's it makes me feel so much better about my soul because I'm doing something good for the world instead of just, making lots of money and sedating people. So, but it's been kind of fun to get to pull her into it.
Liam, I feel like I've been hogging. You can take the next question.
Oh, so, well, the next question is not one that, I had previously, thought of, but it did kind of, jump in my mind, especially how much we've been talking about, or not so much, but we mentioned our former medical director, and something that Dr. Phelps, our former medical director, used to have to deal with a lot and she talked about a lot was that all, the protests and stuff she's had to deal with and, how it affected her personal life, one time she had to be escorted out of her house by armed security guards, stuff like that. Have you had to deal with anything like that? And if you have, how do you deal with that kind of stress?
Yeah, that's a great question. I not had my personal security threatened at home in the way that I know Dr. Phelps and some of my other colleagues here in Rochester have experienced. There was, I can't remember exactly what year it was. I think it was before I moved back. So I want to say maybe 2012, 2013. There was a very large organized month-long protest organized by anti-abortion movement in Rochester that targeted abortion providers at their homes, which was how Dr. Phelps got targeted, and then some of my other colleagues here, who have young children. And I think that was obviously really traumatizing for them to have that brought into their neighborhood, to have these antis knocking on the doors of their neighbors, and really trying to infiltrate their neighborhood. I think that took it to a whole different level for them. So I'm going to knock on some wood and say, as far as I know, they don't know where I live, which is really nice. So I deal more with the feeling of driving sort of through a line of protesters as I enter work. You know, and that happens at our abortion clinic. It happens at our other sites that are, you know, maybe not even doing abortion that day, but just providing routine care, pap smears, birth control, STI testing, PrEP, and people kind of line the sidewalks outside of our clinic. So I have that feeling of not only sort of driving past them, but then in quite a few of our clinics, like, you're not that far from them. They can talk to you. They can say things to you, and sort of absorbing those things, or actually, I should say, doing my best to not absorb those things, but sort of hearing those things that are being said to me. And I think for me, I worry less about my safety, but it weighs on me in the sense that I struggle very, very deeply. And one of the things that I have the hardest time like working my brain around is hypocrisy. So it feels really hard to me to be told by religious people about the judgments that they're passing on to me. And I've gotten to a point where I'm pretty good for my personal heart and soul at letting that stuff sort of deflect or fall off of me. You know, I'm like, that's about them. I still get pissed, and it brings up feelings of anger to me when they impact my patients. And that's really like, that still like, oof, that brings up like real feelings of anger for me. And I will often, you know, be talking to a patient, counseling her, and have her say, you know, they made me feel so bad. I've been in the bathroom crying because of what those people said to me out there. And what it really, you know, what I have the hardest time wrapping my brain around is that if those people saying mean things could actually put themselves in the shoes of the people walking past them, I don't think they'd be out there anymore, you know? And so that hypocrisy is really tough for me to deal with when, you know, people are leveling at me that I should be more Christian, but then they're really doing unchristian-like things to my patients. That hypocrisy for me, I still go to therapy and work through that. Which I'm a big proponent of talking about. Like, I go to therapy, I talk to our clinicians and our staff about that a lot, and I say, you know, I think it's been really important to me. We absorb a lot in medicine. You hear really painful and difficult stories that they are not my personal experience, but I hear them and I get that transference from patients. And so I'm a really big proponent of talking about how, like, for me, the counterbalance in life is like exercise and my husband and my dog and good food, but also like big time therapy, big time stuff.
Yeah,
I like to normalize.
I agree with what you said about like how when it affects like the patients and stuff. Because in like Buffalo, I think at our Main Street location, we're pretty lucky. We don't get too much protests and things like that. Rochester, you guys definitely get way more out there. But
Yep.
one time during that month-long campaign, they did come and they yelled at some of our teenagers that they were walking in. And that like made me and my other coworkers just, so mad. We're like, you cannot talk to our teenagers like that. Like, we're about to go out there. We didn't because, you know, you have to be the bigger person. But yeah, we were mad.
Right, exactly. And I think that's what's tough too, is like engaging in the argument is not productive. So it's hard too, because like you have all of this anger and then like nothing to do with it, because going out and debating with them is not worth anybody's time or energy, and actually decreases everybody's safety to sort of engage in that BS. But it's hard then, because you're like, what do I do with this anger?
You know, I do, so I live kind of close to where we used to do abortion services.
At Wheatfield?
And yeah, in Wheatfield, yeah. And so I would drive by all the time, and there'd be the people out there when the weather was nice. And when we relocated the services for a couple weeks, they didn't realize it. And so I would drive by, and they would just be out there protesting. And I was just like experiencing this internal joy. Like, man, you are wasting your time today. It was really funny. So it made me feel like some real, do you know the phrase schadenfreude, enjoying like the suffering of others? Yeah, I was like, man, it's cold out here and you're not doing anything. So I did not be so, because I don't engage them.
Carry on.
And yeah, so it was. My husband thought it was so funny too. So let's. What do you think the future of birth control looks like?
I loved that question. Of all the ones you guys sent me, I was like, ooh, I got to think about this one a little bit more. So I've been involved for a couple of years in Rochester with something called the Lark Initiative, which of course is an acronym because we love to do that with everything in medicine. But for those who don't know, LARC stands for Long-Acting Reversible Contraception. The most common of which Lynn mentioned earlier is the implant, which goes into the arm, and the IUDs. And now there's a couple of IUDs on the market. There's one that's hormonal, and then there's one that's non-hormonal, which is actually, coincidentally, really the only birth control out there that's long-acting birth control that's truly non-hormonal. It's made out of copper, and as I like to say, it makes sperm unable to swim, and it thereby prevents pregnancy, and is pretty awesome. So I do think this LARK initiative, we've been monitoring data around education of people at risk for unplanned pregnancy, kind of trying to correlate if educating about LARK methods impacts unplanned pregnancy rates. And we've been compiling this data for over 5 years now, specifically in the city of Rochester, which has one of the highest unplanned pregnancy rates for women ages 15 to 25 in the country, interestingly. And so we've been working on this project in Rochester, and what we see over 5 years is that by educating folks about long-acting birth control methods does impact the unplanned pregnancy rate. The unplanned pregnancy rate goes down. And I want to explain that we're not just talking about like educating medical people about these things. This project was really focused on educating quote unquote medical experts in communities. Now, medical experts, first of all, you guys are medical experts in your communities, right? Like you guys are sexual health educators, but even people like the secretary at a doctor's office, in her community, in her home, in her world, she's the medical expert, right? Like when people have health questions, they're going to ask her, oh, she works at a doctor's office. Or, you know, so we try to like hit folks like that with education around like what are IUDs, what are implants. I've given a lot of different lectures like to all the nurses for the Rochester City School District, the camp counselors at the Boys and Girls Club, all the camp counselors at the YW and YMCAs, some of our community-based groups here. So these aren't necessarily health experts, but they are the people that youth go to when youth have questions or concerns in their own community. So trying to educate that layer of people. So I think that's really key, is like people understanding what these long-acting reversible contraceptive methods are and why they're helpful and beneficial. And my one-liner for that is, you set these methods and then you forget them. Like you put them in once and then they're good for years. I love them on a very personal level. I was a very poor contraceptive user before LARC methods in my life. So I really think that is going to be important. The nice thing too is just because they can last for years doesn't mean that they have to. So, you know, they can be removed if people desire pregnancy or don't like the method. And then I'm going to like expand 1 second from there and say, I think LARC methods are super important. I think also access to healthcare and insurance is probably the most important thing when we talk about birth control moving forward. And, you know, I've just decided in the past few months, as I've seen, you know, the racism and healthcare crisis finally get some attention, I'm just going to start talking more loudly about how I really think the key to better healthcare in our country is to remove the tie of insurance to employment. And I think, you know, here's another small silver lining of COVID, is that our country is finally seeing if your insurance is tied to your employer, you know, there's an inherent fallacy there, especially when we're talking about half of our country losing their jobs overnight, right? And so I really think finding a way, whether that's universal health care, whatever that means, finding a way to disconnect the need for a job to mean that you have the right to health care.
On
Do
the
you
same
know?
note, where do you see, or what do you see like the future of Planned Parenthood being with everything that's like kind of going on right now with new court justices and all the abortion laws that are going through?
Yeah, yeah. So I think I truly feel like in my brain, I am planning for two different worlds, right? Like, I think what happens in November, and I want to be very clear, not what happens on November 3rd, 4th, what happens by the end of November, because I think that's what it's going to take to really understand what the implications are for the next 4 years. I really see like two different worlds at the end of November, depending on the outcome of the election. I think that if we are dealing with a scenario where we have Republican-controlled presidency and Senate moving forward, the role of Planned Parenthood is going to be finding ways to maintain access to care for patients across our country. And I really think we're going to move into a space where we're referral states, meaning we refer out, or we're haven states, meaning we still have protection for these things. And the country's going to kind of split into two, right? Like a place where you have access to things like birth control and abortion, and states where you don't. And Planned Parenthood's role is going to be keeping avenues open, honestly, creating like, there's all kinds of different scenario planning for, do we create a bus service to start running from major cities in places where there's no more access? Because I do think if we have a Republican-controlled presidency and Senate, and now, with the obvious concerns around the Supreme Court, I do think that we will see a substantial change in access to abortion in states without state-based protections for that. I think moving forward, if it is not a Republican-controlled president and Senate, in my ideal mind, I think moving forward, we try to maintain all of the progress that we have actually achieved in many different areas in the past decade when it comes to reproductive health. But then I'm more and more thinking about how do we better engage the dialogue that leads to progress for people who disagree with us too, right? Like, how do we not just then lean into like, we were right, F you, moving on, and how do we like actually get some productive dialogue? Because I feel like we're inheriting now, like we were so focused for so long on like political correctness and you couldn't say the wrong thing. And we shamed people who maybe truly felt those wrong things, right? And they then felt like, I can't even say those things out loud because I'll be shamed for it. And what we need to do is create safe places to explore those feelings so that we can maybe work through them and get some progress on them, not just like tamping them down. Because here they are 10 years later saying, you've told me for 10 years, that being a racist is a bad thing, that now I can speak out loud, or I haven't had, and so creating a platform where we can actually like get into that, I think will behoove us instead of just leaning into like, we were right, let's keep marching forward.
I do think you're right about that. I do think that we do shame people if they don't agree with us a lot, and then it causes like a real disconnect. Like in Niagara Falls, our assembly person he's a Republican, but we like find the common interests, right? Like there are commonalities among us, and obviously, and there are vast differences, but like I do believe we have more in common. Like I have to hope that like my cousins who disagree with us, we have more in common than we don't,
Yeah.
And like if you think about it, most people agree with birth control access, right? Like you might disagree with us on access to abortion, but the majority of Americans are like, yeah, I think access to birth control is a really good thing. And so like let's start there and like develop some productive conversations.
Exactly.
I will say though, I accidentally bought an oversized house, and if there needs to be like an Airbnb for abortions, I have 3 extra bedrooms, and my house is open to whoever needs a place.
Thank you. Thank you. I know.
Even though my husband hates house guests.
Yeah, it's going to be interesting to see what happens. Yeah.
Do you have any questions for us, Dr. Potter? It's okay if you don't. Your job is much more interesting than ours.
No, I was just dealing with a quick consult from one of our clinicians. So I do have a question. I know that you guys aren't like in the schools right now as much, like physically, but I'm curious, like with COVID going on, like what have you guys been hearing from, as Liam said before, the kids, or, you know, kind of from our more adolescent or youth population about like what their concerns are right now about sexual health during this pandemic? Like how has that changed at all for you guys?
You know, this is not necessarily related to sexual health, but it kind of is. Liam, you might feel the same way. I really stress. So, do you remember Y2K? I've told Liam this story 100 times. During Y2K, I had like a meltdown. I was 12 years old and I thought the world was going to end, and I like went into like a panic attack. And I couldn't process the feelings because everybody around me was talking like, the world's going to end, computers, money, buy a generator, whatever. And like it sent me into like an awful space for months. And so when COVID happened and, you know, George Floyd was murdered, it really caused me a lot of fears about kids having access to somebody to talk to, right? And so, like, if you're a teenager and you're Black and your grandma's at risk for COVID and people are being murdered by God, like, how are you processing those feelings? And, like, do you have a place to talk about it? Because now school's closed and clubs are closed and no sports. And so we've really been focused on like trying to continue to communicate with students to be sure that they know, like, you don't have a place, like, we're here for sexual health, but we're here for more than sexual health. And like, if you need an outlet for like your stresses, you could always like chat with us, because I mean, sexual health is important, but at the end of the day, like, I'm more concerned about the kid as like a full kid. And I remember like, I like literally, I'm telling you, I like was vomiting. I was so stressed about Y2K. Yeah, no, I had, you know, when your parents are saying things like everything's going to end and you're only hearing that and you have no processing skills, right? You're like,
or no real context.
Yeah. And so my main focus has been like making sure that we are accessible to, so like kids add me on Facebook, I accept every ad. I'm like willing to, I'll do anything at this point, because I remember that deep fear and like COVID and everything else on top of it. How do kids process?
Yeah, absolutely. Not to add, like, I know I've had a few friends' kids have like very similar reactions. This is like years ago, about climate change. Like kids having like existential crises around like, is the world going to be here in 20 years, you know? And like my friends being like, what the heck do I say to them, right? Like, I don't know the answer to that. Yeah.
We had a kid at the Connection when the Amazon was on fire. Like, he could not, because he was like, it's the forests are burning, climate change. Like, he could not handle it. And I'm like, listen, I didn't even know what to say, because I'm like, yeah, I don't know how to handle it either. Oh my God, are we gonna live? I don't know.
I know.
Let's ruminate together.
My husband works at, he's also a family medicine doctor, and he works at a place here in Rochester called Trillium Health, which I've heard is like the evergreen health of Rochester, kind of similar vibes. And their mantra right now is like, just have like an extra dose of patience, an extra dose of everything because of COVID-tude. So like when people like lose their cool or like get overly worked up or feel like out of control, they're like, sorry, COVID-tude. And I love it because it's so true. Like, we're all up to here right now, just like surviving, right? And I don't even have children. Like, I'm not even trying to be a mom and a teacher and a doctor. So everybody's just trying to like survive. And that ability to go off the edge is just so much easier, right? Like, if we're all up here and then there's that one thing pushes us over. So that's been our mantra, is like COVID-tude, COVID-tude, COVID-tude.
It kind of reminds me of like, so Dr. Potter, you're also a runner. Like,
yes.
I can run 13 miles if I know when it starts and when it ends. But the second that I'm like lost, like if I don't know the route, like the Buffalo Half Marathon, I know the route, but I ran the Syracuse half marathon and I didn't know the route. And I'm like 7 miles in, I'm like, I can't make it. Like, you just feel, you don't know where you're going, and you're like, you talk yourself out of it. Where if you know where you're going, if I could say COVID's going to end next July, we're cool, I can coast through this. But yeah, it's like constant onslaught.
Right. Or like not knowing how many more hills or whatever. Yeah. Like I'm like, oh my God, because then you're like psyching yourself out. Yes. Yeah. 100%.
Liam wouldn't relate. He doesn't run. He just does push-ups.
I run every year on the turkey trot.
That doesn't count as running. One day a year.
Well, thank
Liam,
you guys.
Do you have any other questions, Liam?
No, I think that was awesome. I think we covered like pretty much everything.
Cool.
Yeah.
I was going to say, I would just like chat with you guys all day. Unfortunately, I have to go to another meeting here in a few minutes, but I'd love to keep chatting with you guys. And I know I didn't get to say, like, one of the coolest parts about my job is that like there's a whole education department and there's a whole advocacy department, and I get to like collaborate, which that pretty much doesn't happen anywhere else in medicine as far as I know. So I love this, and I would love to keep doing it. So,
well,
thank you so much for coming.
Awesome. Thank you,
guys. Have a good afternoon.
You too.
Oh, you too.
I'll text you what to wear tomorrow, Liam, okay?
Bye.
Maybe somebody could text